And my name is Dr. Maria Sokolina, and I'm a dentist, and I practice in very unusual field. I practice dental sleep medicine. And just like Dr. Zara, we have an office together on 57th Street, and I have another location in New Jersey, and I hope Zara gonna join me in New Jersey soon, starting in October. Yeah. So in a way, you know, people are always scared to go to the dentist, and I feel my mission kind of change that perception. So how I do that? Yes, I try to create a very relaxed atmosphere in the office using aromatherapy and aesthetic and art, you name it. But most of it, I try to develop a relationship with the patients. But also, besides that, I understand dental office is not the best place to develop a relationship. I try to do it outside of my office. So I have a podcast for the last 3 years where, with the help of other professionals from medicine and dentistry, I try to find all missing puzzles of sleep breathing disorders. And I do it through nutrition, physical therapy, traditional medicine with pulmonologists and ENT because nasal breathing, or, you know, clear airway, that's the key to success. And I try to find maybe some traditional ways or unique ways to approach that disease, what we all can sleep well and feel happy next morning and energetic and ready for our mission. And as well, I'm writing a book called Breathless Awakening, where through the storytelling, I talk about, or I tell a story about one family where I try to illuminate the role of sleep in the female world, in the male world, and for kids, because they also suffer from sleep apnea as well. So through this storytelling, I want to show what we can do to help people sleep better and what alternative to CPAP machine exist.
You know what I was actually thinking about? The connection between beauty and sleep, because I was looking at some of the statistics. I mean, we start to age if we don't get enough sleep. And even something like weight gain or risk of obesity, if you get less than 6 hours of sleep a night, I think it's like 27% of risk of obesity. And if you're like sleeping less than 5 hours a night, your risk of obesity is like 73%. It's so, I think we like take sleep for granted. Like, oh, it's sleep, or oh, I didn't get a good night's sleep. It really is a lot more. Like, how is our sleep affecting our bodies from?
Oh, big time, yeah. You cannot feel beautiful if you don't sleep well. And yes, the statistics are great, what you brought up, and it's interesting what everybody consider sleep apnea, you know, the obesity epidemic. Not only obesity, but it's like a cumulative of the shift work and obesity and maybe allergy and inflammation in the body, you know, put together. And now we have 24% of population who have sleep apnea, and they don't sleep well due to the interruption in breathing. And I like how you put it, what people take sleep for granted in the same way they take breathing for granted. So, you know, I'm a human being, I know how to breathe and I know how to sleep. But in reality, that's not true. And that's one of the things, if somebody doesn't sleep well or have sleep apnea, they can really ruin dental work and bring a lot on the table with that.
Why do so many people have sleep apnea?
You know, like I've been in that field for the 15 years, and my view, a little bit different from a general view. Yes, I agree with the fact that, yes, obesity plays a significant role, because actually the first place for visceral fat would be the tongue. Before we get it here, we get it in the back of the tongue.
We get fat tongues?
Wow.
I didn't know we got fat tongues.
Yeah, that's the first place for visceral fat. But actually, you know, in my professional practice, I study a lot of connection between mouth and actually floor, you know, pelvic floor. So, you know, that really kind of go parallel to each other. So tongue goes parallel to diaphragm. If somebody doesn't have active tongue, the diaphragm really suffers. So I see a lot of correlation with that. And people who have temporomandibular joint disorder, very often they have something with the hips. Yeah.
Oh, I have that.
Yeah, so that's, you know, that connection so real to me, because I work a lot with physical therapist, and I try to put that in a neutral position, what the rest of the body can really feel better. But talking about sleep apnea, we'll start with weight. But a lot of time, people who come to me and they say, I don't eat a lot. Like, I don't understand how come I cannot control the weight. Or we're talking about metabolic disease, that also plays significant role. But very often people eat the food what doesn't go along with the body. So it can be just inflammatory response to that particular food what they're eating, what not only gonna show as a weight gain, but also as an inflammation in the nose, as well as in the tonsils. So in general, they have trouble breathing through the nose. And if they have trouble breathing through the nose, they start breathing through the mouth, and then this vicious circle is just going faster and faster and faster and faster. And they collect all this disease, what I see every day: acid reflux, high blood pressure, diabetes, depression and anxiety, sleep apnea, very often periodontal disease. So they come to me, and I open the medical history, and it's always the same.
So how do you know where to start?
Well, I start because I'm a dentist. I start with problems what they will refer to me, because the people who come to me for sleep apnea, they refer to me by medical doctors. But there are some people who I can recommend them to have a sleep study when I see them as my dental patients, and they have a certain sign in the mouth what I can point it out and say, there are several symptoms or signs what I see a lot on sleep apnea patients. I recommend you to have a sleep study. So how they come to me with a sleep study and referral from medical doctor, and I help them to open the airway by doing oral appliance. So that's the basic of my dental sleep medicine practice, because a lot of people, they get CPAP machine and they keep it in a closet or on a side table, but they never use it. And then I do something what they can really sleep with, and it looks like a little retainer, and they can travel with it to go on a bus or plane and not snore, because that's socially unacceptable or not sexy. So that,
So they can use that instead of the CPAP machine?
Yeah.
Wow. So then that begs the question, why are all these doctors, whoever is doing it, giving people the CPAP machines?
Because that's the golden standard. But you, as a divorce lawyer, you know how the trouble started with the sleeping in the separate bedrooms. So they start sleeping in the separate bedrooms because maybe they both snore. And very often when people come to me together, or sometimes not together, but used to be together, they say, oh, she snore more, or he snore more. Like it's important who snore more for not to sleep well at night. Yes, that can all be resolved with oral appliance. Oral appliance is a, traditional,
So we can fix marriages.
Fix marriages, you reunite people in the bedroom, but point is, why doctors recommend the CPAP machine? Because with the CPAP machine, it's a great treatment if you can use it. It's just a stream of air through collapsed airway. Yes,
My husband used to call it my scuba gear. It was so sexy.
Yeah, if you can use it, then bravo.
Yeah.
But, we can try to do something else, and that's going to be much easier. And for a lot of people, it can save marriages, and they can feel energetic during the day. And I really love that. When people, after treatment, they come to me and said, I used to wake up in the morning, and I just can't force myself to get out of bed. But now I have this little thing. And I wake up and I look around my apartment and I see dust everywhere. I want to clean the floor. I want to reorganize everything. So that's very rewarding.
So I guess I'm wondering if you just had used some kind of oral device, is a retainer or something?
Like two retainers together.
Okay. So I can't imagine why anybody would not prefer that over a CPAP machine. I mean,
there are some standards of care. So according to the guidelines from American Academy of Sleep Medicine, we can do oral appliance for people with mild and moderate sleep apnea without even CPAP try-in. But for people with severe sleep apnea, they should be claustrophobic or fail CPAP, how it call it, and then we can proceed with oral appliance. But it's not only oral appliance in the way how I manage in my practice. I call it, it's a therapy. So we work a lot on the nose. I try to teach them how to breathe through the nose, and for a lot of people it's a revelation because it's difficult, because they find it very resistant. You know, it's hard, it's a lifelong habit, so I try to change that habit to make therapy successful. And for some people, I offer them a long game called myofunctional therapy. So it's a physical therapy for the tongue to stay on the roof of the mouth, for lips to stay together, and for people to learn how to swallow with the tongue on the roof of the mouth without moving any lips and cheeks, not to get the
Why are people mouth breathers?
Why people mouth breathers? That's usually start very young. We will start with the breastfeeding. Because if you breastfed, or if you're breastfeeding, it's really hard for you to use your mouth to breathe because you're sucking on a breast. And plus, a lot of antibodies, so it fights the infection. If people are not breastfed, they use the bottle, and that's common in our time. Mom have to go to work, so it's very hard to create that management. I did it. I went to work very fast, but I breastfeed my kids for a year and a half. So, but they get much more respiratory infections. So they habitually start mouth breathing. In the American Indian tradition, mom, after she feed the baby, she put her fingers on the baby's lips and close the lips. This way to remind the baby to keep the lips closed. But in our society, we lost those knowledge. We lost it. So that's one thing. So the baby started mouth breathing. Now, food so amazingly packaged in those plastic containers. So the baby have to do the suck. So they make these muscles work to suck from the package instead of, I would say, chewing the food and then putting the food on the tongue and swallow just with the tongue on the roof of the mouth. So that habitual movement stimulate the jaw growth. So the jaws, they become bigger. Number one, we don't chew much because after the breastfeeding, those packaging food, all this puree, it's so good, it's melting in my mouth, but the chewing muscles, they don't work. They don't stimulate the jaw to grow more. And that's why so many people have extra teeth. We're talking about 4 wisdom teeth.
Oh my God.
They don't have a space, and a lot of people, and thank you to orthodontists, they put a lot of bread on my table, they take 4 bicuspids out. So now we are minus 8 teeth, but tongue did not shrink. Tongue doesn't have anywhere to go but into the airway. And then in the airway, we also have those tonsils. Tonsils, I love this organ. It's a lymphatic tissue which swelled up as a reaction to certain food.
So what do you think, what would you tell moms not to do or to do with their infants as far as as they're growing, what food to give them or not give them?
I would start like that. Number one, I would recommend every mom to breastfeed the baby. And I know it's hard. I definitely know it's hard 2 times. So it's hard, but you have to figure it out. And, they use some glucose on my nipples to make my son, latch to me. But, there are some tricks, and lactation specialists, they exist too. So breastfeeding is number one. After you're done, not done, after you feel what the baby can start chewing on the food, instead of buying that packaged food, just cut the food and give small pieces to the baby. And baby can stimulate the gums to chew. And then eventually they can use the teeth. So that's kind of ancient way. I recently came from Ethiopia, and I cannot say that's good because in our society it would sound so weird, but parents chew the meat for kids, and they give microbiome to the kids, in addition to, they have to chew.
That's interesting. That's called baby birding. And Alicia Silverstone was under fire not too long ago because she said that she was doing that with her child, and she got so much criticism in the community.
Interesting. I hadn't heard of that.
Yeah. I mean, I don't know if that's caught on really here, but
But
Yeah.
actually, that, extra teeth, that can be reversed. They can expand your palate with a special procedure called MARPI. Adults can have palatal expansion with
Really?
additional, I would say with the implants, with the palatal implants, and they can have, volume, a return, I would say, and then teeth can be repositioned to the new, wider position, but it's going to be more space for your tongue. A big proponent in general of treating the symptoms.
Yes.
I like to
I
be
like
a
that.
detective. I like to be a Sherlock Holmes, and I like to find out why people have a TMJ. So I would say my view on TMJ. And I talk about that in the beginning of the interview. When people use the teeth, they want to find the balance. It can be emotional balance or physical balance. Whatever. It can be breathing problem at night. When we can't breathe, we move our jaw forward and open the airway. So yes, if you do that, 50 times every hour, obviously you're gonna wake up with the symptoms, you're gonna have troubles opening the mouth and all of that. If you're using your jaw joint, your teeth for balance, and it can be for visual reasons, when our eyes not connected with our, the rest of the body, because eyes can really act in a very interesting way. You're going to use your teeth to create that balance. If it's not the eyes, it might be your spine, it might be tension. We're all asymmetrical. We have heart on the left side, we have a liver on the right side. We have to stand on 2 feet and hold our eyes on the level of horizon. It's extremely difficult. So we use the mechanism, but it's so close to us, we use our teeth. So it's organs. It's actually the organs what send a lot of messages, and it's all connected through fascia, and it's all connected with the tongue. And what fascia start from the tongue and finish on the big toe of the feet, and it goes through the whole body, including the hips and the knees, and and the feet. So when your TMJ is acting up, maybe you need to be a little bit of Sherlock Holmes and find why. And usually for, people ask me what I do for treatment. So I treat temporomandibular joint disorder in conjunction either with behavioral optometrist or with physical therapist.
wow.
I love that.
Yes, I'll be making an appointment with you too.
It might be sleep apnea too. So it can be on a different level. It was, we both, as you heard, we both from the same medical school. So we both actually were in the dental department at certain point, but some people change the direction and become medical. But in the dental department, just as a medical doctors, we have all medical disciplines. And I had internal medicine, dermatology, OB/GYN.
Yeah.
So not I know as much as my partner in crime, but I have an idea about how body work. And when people come to me, and if they have TMJ, I try to find out where it can come from, but I address it. And I don't want to come back to that. If I do full mouth rehabilitation, I want to restore that smile and enjoy that smile. Not to face my failures every 3 months, whatever. Nope. So I want to find the reasons why it happened. If somebody has periodontal disease, I want to find why, in the sense of bugs. What lives in the mouth? Why is it inflamed so much? And it can be reason. So I try to approach my cases with interest. Because if you just treat the symptoms, it's a recipe for the doctor to get a burnout.
And that's kind of what traditional medicine we see here in the United States is. It's a triage medicine. It's just treat the symptoms. And I love that root cause, trying to get to the why, and fix the why and get rid of.
Yeah, just like you did with going to the bathroom. Of course,
Yeah.
you can give them a medication or tell them don't drink, 6 hours before bed.
Yeah.
But you try to find the underlying reason because body is really smart.
Yeah.